sinusitis और because कई बार क्या होता है कि हमारे जो septal deviation होने के कारण what I try to show you ये आप देख लें this area is very complicated so when the sinus the air moves it goes to the spores अगर ये inflamed हो जाए तो इसको problem होगी ना यहाँ ही problem होगी और ये इतना circuitous pores क्यों होता है क्योंकि when the air moves hot air becomes cool air and cool air become hot air. So that's why the sinus is our humidification system. तो ये सबसे बड़ी प्रॉब्लम है. अगर लंग हेल्थ को इम्प्रूव करना चाहते हैं तो आपका एयर कंडीशनिंग अच्छा होना चाहिए. But that is your filter, that is your humidification system, and another thing it also releases certain gases, what you call the nasal protective nitrous oxide. It has a problem. Nitrous oxide is also acts as an antioxidant, acts as a bactericidal, and also enhances your immune system, what you call respiratory immunity. So, एक तो चीज मानते हैं for whatever reason, if this gets blocked, it has to be opened. Answer is not that हमें दवाई लेते रहो. अब क्या होता है कि bony changes होंगे तो there will be a deflection. And आपको एक चीज याद रखना हमारे दो nostril at a time काम भी करता है. The God has given you two nostrils because it's an alternate cycle. Also human. So read the anatomy of nasal cycle. This is called alternate nasal cycle. एक cycle काम करता है फिर दूसरा आता है. Because it has to be so effective because ultimately the most important part of the immune system is the breath. And what governs the breath is your nasal system. It is called nasal cycle. So humidified होगा, filter होगा. That is a purified air goes into your lung. अब आपका क्या है? Deflection है, inflammation of the sinus है, drip कर रहा है और profession में इस तरह के सस्पेंडेड पार्टिकल्स रहेंगे. अगर आईसीयू में काम करोगे आपको पार्टिकुलेट पॉल्यूशन रहेंगे या फिर हैंडल्स तो ये वेरिएंट एरिया को ऑक्यूपेशन हैजर्ड है. तो हर प्रोफेशनल को याद रखिएगा सिंस वी आर इन इंटेंसिव वी ऑलवेज से दैट योर अपर रेस्पिरेटरी शुड बी वेरी गुड बिकॉज द फर्स्ट बर्थ ऑफ अटैक इन आवर क्लिनिकल प्रैक्टिस है अपर रेस्पिरेटरी. चाहे स्ट्रॉन्ग परफ्यूम्स हो या इंडोर पार्टिकल्स हो या डस्ट माइट्स हो चाहे मोल्ड्स हो सो एवरीथिंग. So you have to improve your nasal hygiene. This is what I call nasal hygiene. How can you improve? The first thing of nasal hygiene is fluid intake. ठीक है. दूसरा nasal hygiene you are using the saline, which you are doing it like this. Third nasal hygiene, what we are taking is that this is a new concept we are using in another way of this. These are called nasal wash. This is another way of nasal wash. You can squeeze put this session. क्यों मैं ये करवा रहा हूँ? Because why my results are very good? Because I am not believing the drug. The drugs can reduce the inflammation, but जो चीज अंदर आ रही है, आपके suspended particles, dust mites, mold आ रहे हैं, उसको आप flush कर रहे हैं. Flush कर दिया. It is something like washing your hands. और flush तो कर दिया आपने, और एक spray देके inflammation कम कर दिया. Inflammation कम कर सकते, zero नहीं कर सकते, because you continuously getting there are certain suspended particles, which is because aeroallergens तो रहेंगे. So most important thing is that जैसे हम वैक्यूम क्लीनिंग कंसेप्ट में ये कहता हूँ, जैसे आप मान लीजिए घर को आप डस्ट फ्री करना चाहते हैं, सिर्फ झाड़ू पोछे से तो नहीं जाएगी. समटाइम्स यू हैव टू suck it or you have to use it. जैसे when you do your car cleaning and your living room cleaning, the suctioning is very important और blowing out is very important. अब साइनस में तो suctioning नहीं कर सकते but blowing out कर सकते हैं. तो उसका कंसेप्ट क्या है? The pore here is very small. बट एक पोर के अंदर से अगर हाई प्रेशर एयर का ग्रेडियंट मैं क्रिएट करूं तो पोर खुल जाते हैं. दिस इज कॉल्ड ब्रीथिंग एक्सरसाइज. अगर हमारे ब्रीथिंग एक्सरसाइज ब्लॉग देखिए, डिफरेंट ब्रीथिंग एक्सरसाइज वी टीच पीपल. बट ऑलवेज याद रखिए कि लंग इज अ वेरी पावरफुल bellow, we call it the bag of air. So that's why we call bellow breathing. अब लंग क्या है? सांस अंदर ले रहा है, सांस छोड़ रहा है. So first you have to use a lung as a balloon. जैसे आपने कई बार देखा होगा एक बैग ऑफ एयर को लोग प्रेस करते रहते आग अच्छी जलती रहती है. हमने देखा होगा जैसे रेस्टोरेंट में. सो बिकॉज एयर द ऑक्सीजन इज अ सपोर्टर ऑफ कंबशन. सो व्हेन यू पुश एयर द फ्लेम इट बिकम्स मोर इन्फ्लेमेबल. आप देखोगे कि गांव में जाओगे कीप ऑन पुशिंग इट. दिस कॉल्ड बेलो ब्रीथिंग. दैट इज हाउ इट कम्स. नाउ द मोस्ट इंपॉर्टेंट द मसल ऑफ अवर रेस्पिरेटरी इज द डायफ्राम. Diaphragm is only when you can squeeze your belly. So what you have to do, this is diaphragmatic. This happens at the lower segments, but that can increase the lung pressure. But what you have to do is that you have to use this gradient to hit the pore. That means you have to create a gradient between pressure at this level to the low pressure. So you have to create that gradient. मतलब your vacuum should be very powerful. So how can you do it? You have to create that gradient, and this exercise is called Bhastrika. So one way of doing Bhastrika is that the classical way, which has been mentioned, is also called the bellow breathing.
You have to keep the
This
mouth
is-
shut.
You have to keep it. और भस्त्रिका करने का सबसे पहले तरीका है, first you have to focus your breathing, focus your mind here and the breath here. When you feel the breath at the level of nose, you can feel the difference. When you breathe in is cool, when you breathe out is warm. And here, so focus. Vector चाहिए. इधर उधर दिमाग चलेगा, so you will not, because you will hit it hard here. This is, the book has mentioned, this is one way of doing a bellow breathing. But our methods and SAANS techniques, what we are doing is that we are using different sinuses. So what I teach is that once you focus your mind and lungs and you're very relaxed, everything is peaceful. After you do the cleansing, so this is called one bellow. Similarly, you can do for. So what I'm doing,
Pressure here.
I'm creating a high pressure to open up the sinuses. This is called equal nasal breathing techniques. This is called nasal panacea. You can read my articles and also. But this is a kind of Bhastrika which I normally ask. You do it, do the regular cleansing. After the cleansing part, after doing nasal wash, nasal saline, then you use the nasal spray. It will be magical. Last में आपको nasal spray. So I am giving you a little video. You can go through.